All right, let's dive in. Today, we're talking about a tool that is absolutely fundamental in healthcare, something that works tirelessly behind the scenes, the SOAP note. It's a beautifully simple framework that brings much-needed clarity to the really complex world of patient care. I want you to picture it for a second. A crazy busy hospital floor. You've got a patient who sees a doctor in the morning, a physical therapist in the afternoon, and a nurse on the overnight shift. How on earth does each person know exactly what the other one saw, what they concluded, and what they plan to do? How do you stop that whole situation from turning into a dangerous game of telephone? Because let's be real, the stakes could not be any higher. A misunderstood symptom, a forgotten detail in a treatment plan, that's not just some small inconvenience. It can directly threaten a patient's safety and their recovery. This was the exact problem that was crying out for a solution. And to really get why the solution was such a game changer, we have to rewind the clock a bit. Before we had a standardized system, medical records could be, well, a mess. They were often disorganized, totally inconsistent, and sometimes dangerously incomplete. This brings us to the 1960s and a doctor named Lawrence Weed. He saw all this documentation chaos and had a vision for a universal structure, a system that would make patient notes clear, logical, and reliable for every single person on the care team. And that brilliant, elegant solution he came up with is what we now know as the SOAP note, a simple acronym for a really powerful method that's used all across the healthcare world today. So what does SOAP actually stand for? It's subjective, objective, assessment, and plan. It's a framework that basically forces you into a logical thought process, organizing everything you know about a patient into 4 very distinct parts. So let's break down what each of those really means. We're going to start with the first 2 letters, S and O. I want you to think of this part as the investigation phase. This is where you're gathering all the clues you can about the patient's condition. S is for subjective. This is everything the patient tells you. It's their story. It's their personal experience, their symptoms, how they're feeling, their history, all of it, in their own words. It's the narrative, and the key here is to capture their perspective as accurately as you possibly can. And this right here shows you the power of detail. Patient complains of chest pain. Okay, that's a start, but it tells the next provider almost nothing. Now compare that to the precise version describing the quality, the severity, where it is, what makes it better or worse. Now that is actionable information. Next up, O is for objective. So if the subjective section is the patient's story, the objective section is the hard evidence. This is where you write down everything you can measure, see, and verify for yourself. We're talking about things like vital signs, blood pressure or heart rate, results from lab tests or x-rays, and the things you directly observe during a physical exam. It's not about what the patient says they feel. It's about what you, the clinician, can factually observe and document. And, it's also super important to know what doesn't go in here. The objective section has to be totally free of your personal judgment or opinion. Labels like difficult or uncooperative have absolutely no place. Instead, you just describe the behavior you saw. So instead of writing non-compliant, you'd write, patient did not take medication as prescribed. See the difference? It keeps the note factual and professional. Okay, so we've gathered our clues, we have the patient's story, and we have the hard facts. Now we can move to the second half of the SOAP note, the assessment and the plan. This is where all that clinical reasoning really happens. A is for assessment. This is your professional analysis. And it's not just a summary of the S and the O, it's the synthesis. This is where you take the patient's story, you take the objective findings, and you explain what you think is actually going on. You connect the dots. The process is really logical. You review the subjective clues from the patient, you correlate them with the objective evidence you found, and then you form your clinical impression. For example, connecting the patient's report of that squeezing chest pain, that's the S, with specific changes you see on their EKG, that's the O, allows you to synthesize a diagnosis. And finally, we get to P for plan. This is so important for making sure care continues smoothly. It's the concrete, actionable roadmap that details exactly what is going to be done to address the patient's problems. And again, the difference in detail is just critical. A vague plan like prescribe antibiotics just creates more questions, right? Which one? What's the dose? For how long? In contrast, that actionable plan leaves zero room for confusion. It tells any other provider on the team exactly what to do and when to check back in. A really rock-solid plan has all of these pieces. It gets into the specifics of medications, any referrals to specialists, what the patient needs to know, and when they need to come back. It sets clear, measurable goals so that everyone can track progress effectively. So let's circle back to the big picture here. Why is mastering this simple SOAP format so incredibly important? Because a well-written SOAP note does all of this. It seriously enhances patient safety by cutting down on errors. It helps diverse teams communicate like a well-oiled machine. It ensures care is consistent and continuous. And at the end of the day, it just leads to better quality of care and, most importantly, better outcomes for the patient. Ultimately, a medical record isn't just a boring file. It's the story of a person's health journey. And the SOAP note is the framework that makes sure that story is told clearly, accurately, and effectively. Because every note tells a story. The question you have to ask yourself is yours telling the right one?